So FLAIR was a UK-initiated phase 3 design study. This was looking at comparing different treatment options. This was an adaptive trial design. Initially, we designed the trial comparing chemoimmunotherapy for fit patients in the form of FCR versus Ibrutinib Rituximab. And then the trial was adapted to include two arms, which was Ibrutinib and Ibrutinib with Venetoclax. The last arm, Ibrutinib with Venetoclax, was given as an MRD-driven approach. So this abstract basically looked at comparison of the standard arm, which was FCR, versus Ibrutinib with Venetoclax, given in an MRD-driven approach. So to explain that, the patients who became MRD negative at 1 year of combination therapy received 2 years of therapy. Patients becoming MRD negative at 18 months got 3 years of therapy, and then the patients who got MRD negative at 24 months got 4 years of therapy, and the maximum duration of therapy was 6 years in this trial. So the trial recruited 523 patients, 260 patients got the experimental arm, which was I plus V. And in this abstract, we've shown that this, at 3 years, there is a progression-free survival advantage in favor of Ibrutinib with Venetoclax as compared to FCR. We saw this in all types of CLL, including unmutated IGHV patients and patients with cytogenetic aberrations. But really the marked change was in the unmutated IGHV patient. I think the main news from this trial is that this led to an overall survival difference as well in I plus V given an MRD-driven approach versus FCR, which is the first trial actually to show an overall survival difference with this combination therapy as compared to chemoimmunotherapy in the form of FCR.